Hello, friends. Thank you so much for tuning into Amina's session. As always, I get promising notes at your end and very special guest. Yes, the specialty of today's session is Doctor Talk. I've been getting doctors from around the world specialize in many things, and they talk about relevant subjects, which is actually important in today's going on situation of the people all around you. Now, let me introduce you to a special doctor and a very dear friend of mine. She is MBBS MH, is a result-oriented business and healthcare professional with extensive experience in heading business operations for 20 years in Oman, leading in multi-specialty hospitals like Apollo and Aster Group of hospitals. She served as a doctor in operations in Oman. Now, that is fascinating altogether more. But apart from that, being in Oman, now she is based in Hyderabad and she is a VP of KAMENINI Fertility Center in Hyderabad. Everybody believes her, and the way she counsels her patients, that's again a remarkable approach from her side. She's here to discuss on a topic which is very necessary for the couples who are facing difficulties. Everybody would love to have their own child. And today's subject is all about that. The highest standard of sexual and mental health care. Now, sexual is basically the fertility which is going to be talking about. Now, please put your hands together to welcome Dr. Asma Khan, the VP of Kamenini Fertility Center, all the way from Hyderabad in my session. Thank you so much. Assalamu alaikum, doctor. How are you doing?
Walaikum salam, Amrina. Alhamdulillah. How are you? It is
I'm
so
fine.
pleasure seeing you after a long time.
Yeah, same here. I was actually excited to get you on board because you are first my friend, and then a doctor. You're such a sweet
I know,
personality.
I know. Yes,
Uh, so,
that's my
um,
profession. Yeah,
Thank you so much, Doctor. Doctor, can you just highlight about the purpose of the topic which you have chosen today, the highest standard of sexual and mental health care?
yeah. It's going to be mental health care. As you know, today's world, I think recently you might have heard of many people, many good personalities committing suicide, because of which, we have to bring an awareness to the people. Actually, what is mental health? How it, is going to affect the person and as an individual. It can be to anyone. It can be to a child. It can be to an adult. It can be to an aged person. It can be to anyone. So we are going to speak about a mental health and also mental health, how it's going to affect the infertility in a couple, in a married couple.
Okay. Okay. So, what is the main and the basic purpose of? Okay, basically, we'll go with this way. What is mental health?
As I told you, mental health includes, emotional, psychological, or social well-being. It affects the person's, how he is going to feel about it, how he's going to act for it, how he's going to take that, pressure onto it. It is not necessary. It should be only financial. It is not necessary. It should be. It can be to a student. It is a peer pressure from the other students, or sometimes they take pressure from the teachers or they take pressure from the peers. For a married couple, it is a pressure of not having kids after the marriage. And for the adults, it may be a financial problem, it may be a job pressure, or it may be a family circumstances. So we cannot define mental pressure as one line. Okay, this is mental pressure. It can be, mental health can be from any form. It can be from any form.
Okay. Like what forms? Can you just highlight few of them?
The mental health causes are like stress, you can take it off, abuse, traumatic situation. As I told you, it can be any situation which is not willing to take as an individual. If the person is not able to ready to take it, grab it, and he will not be peaceful with that, it is a mental health. It's a depression for him.
I see. Okay. And what will be the disorders of mental health person? Like normally, how can we analyze that he's
Suppose
going through?
Yeah, fine. If suppose a person is having a depression, restlessness, tensed, most of the time his mood swings. You can say some people, even if you everyone in the crowd, they feel very lonely. Even if they have a
Yeah.
lot of money, also they feel okay, depressed. There is something lacking into them. So you can feel when you look at the person that he's having some problem. He will not look happy. You can make out with his eyes that the person is not happy.
Hmm. So, doctor, do you think that, okay, you must be getting so many cases in your hospital naturally, and many of them, they desire to have their own children, and at the span of time, like 6 years down the line, now 10 years down the line, they are without their, I can say good news. So, how do you manage to get them comfortable, and how you counsel them? Because I've seen your setup, it's simply amazing, and the kind of treatment you people give. Just highlight a few things about that.
Okay. See, fertility is not a disease. First of all, let us understand it's not a disease. People assumption is they think if they are not having kids, there may be something they are lacking behind. They feel it is something disease which they cannot speak about it. Especially in men, they have an ego problem. They will feel okay, there is something lacking into you means they think okay, we can't discuss with this with anyone. Even in this generation, even we have come up, we have went on the moon, we have achieved so many things, but still there are certain things people still feel okay, we cannot come out of it. Fertility is a problem where parents, sometimes it's for the female it can be a late marriage, it can be any physical health also, any hormonal imbalance or any other things. For the male also, it there is some, if there is a sperm count is low, or the person is having some other chronic ailments or anything like that, the inability to conceive is a fertility. There are treatment for any fertility problems. It is not key, okay, if you have a fertility, you cannot conceive a child, okay, forget about it. It's not like that. There are treatment for every cause, there is a treatment. If there is a reason for not conceiving, you have to go to a proper specialty doctors, go for the investigation, go for the test, find out what is the reason why you have not conceived. And how it is going to help your mental health. Fertility, like people, as soon as the girl gets married, after a few months or something like that, people start asking, okay, is there any good news, is there any good news, to face that situation. That is
Yes,
also an
yes.
important situation for the girls. For the couples, if they are going somewhere, if they got married after 2 years, 3 years, they ask, oh, is there any good news for you? So it's like a friends, relatives, neighbors, at home. So it becomes so much depression for them. Even that is also one of the reasons.
Yes, yes.
Even without any problem, even with that depression also, they don't conceive.
Uh-huh. Okay. Doctor, what do you think? After seeing and studying so many cases in front of you, what is the major cause of infertility? Like there must be many. There must be, not satisfied about their job, or about their financial condition, but in and out. How much percentage do you give to this particular thing as saying, okay, fine, this is causing a major health problem or infertility if in a patient?
Okay. Nowadays, if you say major problem because of the circumstances, the social life, what we are living, the food habits, the lifestyle, the sedentary lifestyle. We are having so many different kinds of foods. We are having the obesity. Because of obesity, the female ends up with the PCOD problems. So many things are there. Even in the male, there is a sperm count because of the drinks, alcohol, smoking, and all. This count will become less. So that is also one of the reasons. I cannot say there is one particular reason for infertility. There are various reasons. In a male, it's a sperm. In a female, it can be tubal problem, it can be ovulation, it can be uterine problem, it can be PCOD. There can be any number of things. We cannot say, okay, this is the only reason because of infertility. We have to find the root cause, what for whom the problem is, whether it is a male, whether it is a female. Until unless we go for investigations, there are certain investigations which will rule out the cause of the infertility, where we can treat the patient. After knowing the cause, we can treat the patients.
So, how much time duration is there for such kind of patients with you?
I can't hear you. I can't hear you, Amrina.
Can you hear me now?
I can't hear you.
Now you can hear me?
No, I can't hear you.
I can hear you perfectly. Can you hear me now?
No, I can't hear you. I think there is some audio problem, is there?
Can you hear me now?
No,
Really? Can you
I can't hear you anything. Is it from your side or from my end? I don't know. Can you hear me? Ah, but I can't hear you. No, no. Slowly. It's very low. No.